Welcome back. Nearly 57% of the U.S. population has been vaccinated against COVID-19. While some people who have yet to get the jab are just flat out refusing, others are hesitating. I spoke with Dr. Ziv Cohen, a forensic psychiatrist at Cornell University, to find out what's behind the hesitancy. Dr. Cohen, thank you for helping us tackle this subject. Vaccine hesitancy. I know a lot of people still are debating whether or not to get the vaccine. Do you see social media, how this plays into it? Like, where do you think that hesitation comes from?
I think that it's multifactorial. I think one issue is that people are still frightened by the pandemic. The pandemic has unsettled everyone, has given everyone health concerns. And so just like people are, for the most part, avoiding crowded places, avoiding things that they typically used to do, introducing a novel vaccine, a novel treatment that came out relatively quickly is frightening to people, and people don't necessarily understand the science behind it. So this is validated science. It's actually science that existed for a long time. But to average citizens, it often seems like it's maybe something that was improvised, put together quickly, without adequate safety. And so people are just hesitant to have the vaccine. I think that that's the best case scenario for vaccine hesitancy, but I also think that there are other more sinister underlying issues related to disinformation. And I think that that's where social media does come in, unfortunately, in a negative way. I think social media has many positive aspects to it, but people share a lot of disinformation, and there is research to show that disinformation moves more quickly through social media than bona fide information. And certainly the types of videos and memes that are peddling conspiracy theories are very juicy for the human visual system and for the human brain, and they can bypass our rational centers in our brain that help us weigh evidence more objectively. And so I do think that that pushes people to a stance of anxiety and emotional thinking rather than thinking based on hard facts.
Yeah. Does mental illness possibly play a role in all of this too?
I think that, it's a very interesting question. So studies of people who have severe mental illness have by and large shown that they retain the ability to make healthcare decisions for themselves. So although it does happen, it's relatively rare in a medical setting, for example, that you would have someone that just because they're mentally ill cannot make medical decisions for themselves. When it comes to something like a mass vaccination campaign, that's a little different. That's not a person sitting with a healthcare provider necessarily and making a decision about their health. I think that in a mass vaccination campaign, people who have mental illness typically have poorer access to care. They're less able to avail themselves of resources, to be connected to individuals that can bring them help. And so, I think there's more research that needs to be done, but I think it's possible that the mentally ill segment of our population is behind on getting vaccinated for reasons related to access to care. I don't think that mentally ill people in general are more susceptible to conspiracy theories, but there are some notable exceptions to that. If we look at extreme conspiracy theories like QAnon and so forth, we have seen some patterns where people who are maybe not that mentally stable have taken that in a very extreme direction.
I feel like this has so many layers to it, but kind of bottom line, I feel like right now when you're talking to people, are there some like do's and don'ts of bringing up the vaccine? Are you vaccinated? Do you just don't ask? Like, what do you recommend we do?
You mean with friends and family?
Friends and family, right. People that you are encountering.
Well, I can tell you that it's an emotional subject and people get very riled up and angry and hostile, whichever side of the spectrum they're on in terms of being vaccinated or opposing vaccination. I think, though, that we would all be doing a disservice if we didn't talk about it. We have to find the right way to talk about it. And I think, hopefully we know where our loved one, what their position is, so we can approach them with that knowledge. And if we have a sense that they're against vaccination, maybe the conversation needs to be that we are in a scary time and that new treatments can be anxiety provoking, and asking specifically what are the anxieties and trying to understand them, because that's the first step to slowly debunking the anxieties that people have.
So to get the reliable information that's factual based, where should people be going for that?
Well, fortunately, there are great sources of information. So, for the most part, big media like the major newspapers have been reporting well and have had experts come and opine. You can certainly go to the CDC website, which has a lot of up-to-date information on COVID hotspots, on the vaccines, information on the different types of vaccines. The National Institute of Health as well, the Division of Infectious Disease, has good information. So I think that going to those types of sources can certainly arm you with the facts when you're making decisions about your own health or trying to help a loved one think about why vaccines are important and why they're safe.
Yeah. Dr. Cohen, thank you so much for all of your advice today. I guess it's just kind of one day at a time right now.
That sounds about right.
As Dr. Cohen said, you can get more information on COVID-19 and the vaccine from the CDC and NIH.